Hello, it is 9 p.m. in Art. This time to English New Edition. For today headlines, we have the President of the Republic in Tadjourah for the inauguration of the Dr. Burhan Mohammed Arif Regional Hospital. The launch of the activities for the second edition of the National Arabic Week in the Republic of Djibouti. For the international scene, UNICEF calls for action as children are exposed to the worst in Gaza. Welcome to our newsroom. The President Gele inaugurated the Tadjourah Regional Hospital Sunday. The President of the Republic, His Excellency Ismail Omar Gele, has inaugurated the Tadjourah Regional Hospital, which will bear the name of Dr. Burhan Mohammed Arif, an illustrious Djiboutian physician and one of our country's first practitioners. A brand new facilities. The hospital opened today in Tadjourah, capital of the regions of the same names, incorporates all the usual health services, including general medicine pavilions. This new public health buildings is the result of a partnership between our country and China built over a period of 2 years. The infrastructure is also highly regarded for its ability to include a huge esplanade adorned with the greenery and plantations, idea for the relaxation and well-being of convalescents. The official inauguration ceremony of the Tadjourah Regional Hospital was marked by the regional hospitals also boost an internal medicine unit, high standards medical specialties often appreciate for its established propensity to provide services in all areas of health. Upon his arrival in the Tadjourah region, the President of the Republic was warmly welcomed by the Prime Minister Abdul Qadir Kamil Mohammed and the President of the National Assembly, His Excellency Dileita Mohammed Dileita. The President of the Republic, His Excellency Ismail Omar Guelleh, inaugurated this morning the Tadjourah Regional Hospital named Dr. Burhan Muhammad Arif to the chief in homage of to the chief physicians Dr. Burhan Muhammad Arif, who worked to provide quality care for the local population. The inauguration of this medical center symbolizes an important step in the improvement of health infrastructure in the countries and its interior regions. This regional referral hospital covers an area of 4,132 square meters and comprises 3 floors with a capacity of 117 beds. These health facilities features modern architecture and state-of-the-art medical equipment to cover the medical care needs of the 2 northern regions and sub-regions, Tadjourah and Obokh. The Dr. Burhan Muhammad Arif Regional Hospital comprises a range of multi-purpose medical facilities, including emergency services, maternity wards, operating theaters, a neonatal unit, a pharmacy, an X-ray department, a laboratory, and an intensive care unit. The inauguration of this hospital, equipped with modern technology and specialized services, aims to offer quality care to the inhabitants of the Tadjourah and the surrounding areas and to strengthen the health care offered in the northern region. This hospital project is the result of the sustained effort and hard work since the construction work was launched in March 26, 2022 by the Head of State Ismail Omar Guelleh. The inaugurations of this reference hospital infrastructure in the northern region is a perfect illustration of the Head of State vision to offer each region its own regional hospital in order to ensure generalized health coverage throughout the territory by increasing the infrastructure for basic care and specialized facilities for the people of Tadjourah.
inta dunidani ku nooshahay cidaan kugu doorsana ma jirte ducaysana bageelo hogaanka dalkeena noo hayo dadkaaga ku jecel daadi jir heeganoo dareen badan duruufaha dunida ku habsaday dhiftiya dacatiga dagaalada
dalkeena badbaadiyaa tahaye dalkeena badbaadiyaa tahaye
The inauguration ceremony of the Tadjourah Regional Hospital by the President of the Republic, His Excellency Ismail Omar Guelleh, was attended by several members of the government, including the Prime Minister, His Excellency Abdul Qadir Kamil Mohammed, the President of the National Assembly, Dileita Mohammed Dileita, the Minister of Health, Dr. Ahmed Rabil Abdillah, all as well as numerous members of Parliament, local authorities and health professionals and local residents who came to celebrate the opening ceremony with this new hospital. Tadjourah has acquired an essential tool to meet its health challenges by offering its population quality care thanks to this local medical center, which aims to provide quality services. In his speech, the head of state expressed his delight at the inaugurations of this infrastructure, which will help to break down the barrier between the northern regions and ensure efficient medical services. With this brand new hospital, Tadjourah is positioning itself as a major health hub in the north of the country.
waxaa ku bogay dadkaagii
halyay taladiisa lagu dagayo gudaha iyo dibadaba daafacayo dalkiisa horo margaarsiiyo dagana cadowga duruusu dhigto waxaa ku bogay dadkaagii waxaa ku bogay dadkaagii waxaa ku bogay dadkaagii intaad dunidani ku nooshahay cidaan kugu doorsanaa ma jirtee ducaysane aabbageelo hoggaanka dalkeena noo hayo dadkaaga ku jecel la daadii dadkaaga ku jecel la daadii dadkaaga ku jecel la daadii intaad dunidani ku nooshahay cidaan kugu doorsanaa ma jirtee ducaysane aabbageelo hoggaanka dalkeena noo hayo dadkaaga ku jecel la daadii dadkaaga ku jecel la daadii dadkaaga ku jecel la daadii Tagoribaro, Tarikh
The Minister of Health, Dr. Ahmed Rabil Abdullah, said it is with immense pride and deep emotion that we gather here today to celebrate a historic moment. Listen to the report.
Avec un immense fierté.
It is with great pride and deep emotion that we are gathered today to celebrate a historic moment, the inauguration of the Tadjourah Regional Hospital. This event marks a crucial step in our shared quest for a more equitable, accessible, and efficient health system for all citizens. Health is a fundamental right, and our commitment as a government is to guarantee every citizen, regardless of their geographical location, access to quality care. This hospital is not only a modern infrastructure, it is a symbol of our determination to reduce disparities between regions and strengthen access to care in rural as well as isolated areas. The regional hospital is equipped with the latest medical technology, including an operating theater, intensive care units, a maternity section, as well as an emergency department capable of meeting the most pressing needs. Thanks to this structure, the inhabitants of the northern region will be able to benefit from specialized care without having to travel long distances. In addition, this hospital will play a central role in the prevention and awareness of chronic disease, which remain a major challenge in our country. This achievement will not have been possible without the unwavering support of the President of the Republic, who has made health a national priority. I would like to thank our brother and friend country, the People's Republic of China, which funded the expansion and equipment of the Tadjourah Region Hospital in the form of a donation. This hospital will not only meet the needs of the population in the Tadjourah region for access to medical care, but also cover the Abakh region and will hugely facilitate access to medical care for the population in these northern regions of the country. My thanks also go to the people of Tadjourah for their patience, support, and cooperation throughout this project. This hospital belongs to you. It is your health, your future, and that of your children. But our work does not stop here. This hospital must become a driver of development for the entire region. We must integrate it into a national health care network that continue to develop in order to meet the growing needs of our population. To the health personnel assigned to this hospital, your work is not a job, but a vocation. The health of your patients always remains your first priority. With the epidemic disease raging in neighboring countries and elsewhere in the world, always be present for community surveillance and prevention as a first line of defense by communicating possible risks with the population, which will facilitate their engagement in improving health, make rapid detection, diagnosis, and treatment of patients who confide in you. The Ministry of Health will ensure that this hospital operates efficiently, transparently, and with respect for each patient. We work to ensure affordable care, constant availability of medicines, and qualify and motivate staff. On this day, we sow the seeds of better health for North Tadjourah and its surrounding. Let us take care of this legacy together and make this region an example for our entire country.
It is with immense pride and profound joy that I stand before you in Tadjourah, said the Head of State, His Excellency Ismail Omar Guelleh.
بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسوله الأمين سيدنا وحبيبنا محمد صلى الله عليه وسلم. C'est toujours avec plaisir que je me tiens aujourd'hui.
It is with an immense pride and profound joy that I stand before you today in Tadjourah, a place that represents the richness and diversity of our nation, to launch a project that is crucial to our health system and the well-being of our people. The Dr. Burhan Mohammed Arif Regional Hospital, which we are celebrating today, goes far beyond a simple construction. It embodies our collective commitment to ensuring that every Djiboutian, regardless of where they live, has access to quality care. With this new infrastructure, we are providing the two northern region with modern equipment and adequate medical expertise to meet the growing needs of our fellow citizens. Health is a fundamental right. By inaugurating this modern hospital equipped with the most advanced technologies and offering essential services, we are making significant progress towards universal health coverage accessible to all. However, our ambition goes far beyond that. The government is working hard to ensure that no region or locality is left behind when it comes to quality health care. Public health remains a priority in our vision of inclusive and balanced development across the country. We also wish to pay tribute to one of our country's medical pioneers, the late Dr. Burhan Mohammed Arif, who was the Chief Medical Officer of the Northern Region. During his term, he established the first health center in Tadjourah and Obokh while connecting these regions. May his memory and dedication to his compatriots be honored through his hospital that now bears his name. These initiatives illustrate an unwavering commitment to improving the well-being of our population and ensuring equitable access to healthcare throughout the country. In this regard, the Ministry of Health has invested heavily in modernizing the national medical infrastructure. Many hospitals and polyclinics have been renovated and equipped with modern medical equipment to better serve citizens even in remote areas. Reforms have also been put in place to ensure access to care. These reforms represent a crucial step in optimizing the Djiboutian health system. However, their success depends on collaboration between all stakeholders. Building a hospital is already a challenge. Training and investing in competent healthcare staff is an even greater one.
President Gelle said that many hospitals and polyclinics have been renovated and equipped with modern medical equipment to better serve citizens even in remote areas. The Harif State added. Listen once again to the Harif State.
L'initiative illustre un engagement.
We invest heavily in it, and in turn, we simply expect diligence in their care as well as genuine compassion for their patients. Like the illustrious doctors I mentioned earlier, we have a long tradition of healthcare staff respected not only for their skills but also for their kindness to those they serve. I sincerely hope that this tradition will continue. Together, let's build an inclusive and sustainable healthcare system. Ladies and gentlemen, esteemed guests, I would like to express my sincere gratitude to all those who contributed to this important achievement. The People's Republic of China, a loyal friend country, the medical and technical teams of the Ministry of Health and local authorities. Investing in health is an investment in the future. By ensuring that every citizen enjoys good health, we strengthen not only our families but also our entire nation. I therefore encourage you to preserve this hospital as an example of medical excellence and a symbol of community solidarity. Let us continue together on this path towards progress and development for our country.
The President of the Republic said that Tadjourah, a place that represents the richness and diversity of our nation, to launch a crucial project for our healthcare systems and the well-being of our population. The Dr. Burhan Mohammed Arif Regional Hospital, which we are celebrating today, goes far beyond mere construction. It embodies our collective commitment to ensuring that every Djiboutian, regardless of where they live, has access to quality health care. With this new infrastructure, we are providing the two northern regions with the modern equipment and medical expertise to meet the growing needs of our fellow citizens. Arab Parliament meeting in Cairo in a very changing regional context, disparately marked by unprecedented geopolitical instability and persistent tensions. The Arab Parliament met at the Arab League headquarters in Cairo from December 11 to 16, 2024. The Djibouti parliamentary delegation, led by the Honorable Deputy, the Member of Parliament Ibrahim Ahmed Abdo, took part in this important meeting alongside members of Parliament Abdo Kamil Mohammed, Mahmoud Hassan Farah, Ali Zaid Ahmed, and Arab Affairs Advisor Ali Amdan Abdou. The meeting took place in an atmosphere marked by a new spirit of cooperation and focused on a number of areas facing major challenges, particularly Syria, Gaza, and Lebanon. The launch of the second National Arabic Language Week in the Republic of Djibouti this Wednesday, December 11, 2024, the Ministry of National Education and Vocational Training launched the activities to celebrate the National Arabic Language Week under the high patronage of the Menfop, His Excellency Mustafa Muhammad Mahmoud. This second edition is opened at the Center for the CFF. The inauguration ceremony was presided over by the Secretary General Mohammed Abdullah Mahyoub in the presence of the Director General of the CFN Ni'ma Hassan Ahmad, the President of the Organizing Committee Ali Yusuf Douale, as well as numerous officials from the Ministry of Education, directors of Arab private schools and their students. In his speech, The Secretary General Muhammad Al Mahyoub officially declared the opening of the activities of this second edition of the National Arabic Language Week. He highlighted the importance of this event as a key initiative to celebrate and promote the Arabic language, an essential pillar of Djibouti's cultural and national identity. He also emphasized that this week is a unique opportunity to collectively reflect on concrete and innovative ways to strengthen the place of the Arabic languages in the education system. The celebrations of the World Arabic Language Day in Rastika and Balbala, the aim being to promote the Arabic language in Djibouti. The aim was to promote the Arabic language and highlight its rich heritage. The ceremony was particularly marked by the recitations of the verses from the Holy Quran by pupils from the Djibouti Women's School Union School, creating an spiritual atmosphere. Afterwards, students from private Arabic schools captivated the audience with the theatrical and cultural performances highlighting the beauty of the Arabic languages and its essential role in civilization. And this capacity building workshop on the 1972 UNESCO Convention, this morning the Ministry of Youth and Culture, in collaboration with the UNESCO Djibouti, launched a capacity building workshop on 1972 Convention concerning the protections of the world cultural and natural heritage. The aim of the workshop is to raise participant awareness of the issues involved in preserving world heritage and to improve the knowledge and skills of professionals and players in the sector in terms of sustainable management of listed sites. The event brought together a wide audience, including various government ministries, site managers, researchers, representatives of the NGOs and community organizations, UNESCO experts, and other world heritage specialists. The workshop will continue until tomorrow. According to the introductions to the ceremony, it is expected to focus on the process involved in inscribing on site on UNESCO's lists of cultural and natural heritage sites. On Saturday, December 14, 2024, the Intergovernmental Authority on Development organized the work of the fifth meeting of the board directors of the IGAD region universities forum opened this Saturday, December 14, 2024, the University of Djibouti. The eminent personalities, including deans and president of the universities, recognized the experts and researchers gathered around the table to discuss topics of vital interest to higher education with the aim of promoting the development of skills and added value among the region's youths. This meeting marks a key moment to strengthen regional partnership, develop innovative strategies, and implement concrete actions to meet the current challenges of education and skills development in the IGAD regions. Fathia Abubakar Alwan, Director of IGAD's Health and Social Development Division, Dr. Kabede Kassa Sgai, PhD Senior Coordinators of the Education, Sciences, Technology, and Innovations Programs at IGAD, and Dr. Hassan Ali Barkat, Director of the Doctoral Schools at the University of Djibouti, officially opened the forum. On the agenda of this fourth Council's meeting were the final selection criteria for candidates shortlisted for the second rounds of beneficiaries of the IGAD scholarship programs. Other issues relevant to the regions, including digitization,
May 2024. These efforts underscore the region's commitment to equitable and accessible education for its most vulnerable population.
The director of IGAD Health and Social Development Division, Fathia Abubakar Alwan, said that the aim of promoting the development of skills and added values among the region's youth, this meeting marks a key moment to strengthen regional partnership, develop innovative strategies, and implement concrete actions to meet the current challenges of education and skills development in the IGAD regions. On the agenda of this fourth council meeting were the final selections of criteria for candidates shortlisted for the second rounds of beneficiaries of the IGAD scholarship program. UNFD, in collaboration with the UNICEF, organized a public declaration ceremony for the total abandonment of all forms of female genital mutilations at the CDC of the neighborhood. For the ceremony began with the folk dancing testimonies by the women of the neighborhood District 4 communities, and the public declarations for the total abandonment of all forms of female genital mutilations by the entire District 4. Afterwards, a reward was given to the community women of the neighborhood for by UNFD, followed by the cutting of the calves, and a family followed. For his part, the head of the CDC, Mr. Ali Muhammad, emphasized that the community women of the neighborhood had worked hard to eliminate female genital mutilations. Supporting a community initiative to preserve the environment and empowering women, among other things. These are the objectives of the Global Environment Facilities microfinanced programs and implemented in Dakhil, held in Abaitu. In this way, 5 community projects aimed not only at local food security, but also generate additional income for additional household income. This project was implemented by the Mudan Association of the Unity Regions. Founded 5 years ago, this association is active in several fields, including sustainable agricultural development, support for community initiatives, and of course, women's empowerment. Thanks to funding from this program, the association has been able to access a reservoir, installs 400 meters of piping to supply the gardens, and the next phase of the microfinance program will be relaunched in the early 2025 with the aim of continuing to support new local initiatives for sustainable and inclusive development. Tomorrow it will be the turn of Hori in Ali Sabir, where the Global Environment Facilities small grant programs will help local livestock farmers gain better access to water for the livestock. For the international scene, Gaza, UNICEF calls for actions as children are exposed to the worst horrors. 33 people, including at least 8 children, were killed in a new devastating attack on the Nusayrat camp. Listen to the report.
For action as children in Gaza face massacres every day, the world cannot remain indifferent to the situation where so many children are exposed every day to violence, hunger, disease, and cold. Catherine Russell, 10,000 children have been killed in the past 14 months, and that almost all of Gaza's 1.1 million children require urgent protection and mental health support. There is no safe space in Gaza or stability for children who lack essential goods such as food, clean water, medicine, added Russell.
Antonio Guterres' health energy transition is on a visit to Lesotho. The Secretary General of the United Nations highlighted the Southern African countries' Green Transition Initiative. Listen to the report. And this is it for the news. Thanks for watching us. Have a good evening.